Beauty is skin deep and aging is inevitable. But nowadays with technology, we have an array of options to choose from. We have Dr. Gaon and Dr. West from Finesse Plastic Surgery to tell us what some of those options are and how to make wise choices, especially when it comes to facelifts. So, gentlemen, when does a person become a good candidate for a facelift?
There's no age that's too young. It's certainly when the patient comes in and says, you know what, looking in the mirror, I'm seeing features that weren't there before. The jowls start to sag, they start to get a little bit of excess skin and tissue in the neck, especially nowadays when we're working with technology, we're looking down, doing FaceTime with our telephones, we're leaning over, we're accentuating what gravity is doing to us.
So really what you're saying is technology is encouraging us to age.
For some, yes. For some, it creates the illusion of aging because gravity and pushing forward is going to bring features down.
Wow, okay.
So the idea is we want to reverse those effects. We want to give the patient a refreshed look. So when I talk to patients, I always tell them to imagine taking a mirror, looking at it, instead of looking down into your tablet, look straight up like this. This brings back gravity, plus add a little extra, and that's the desired look for what changes we want to encourage during facelift surgery.
Are you saying with technology that we're getting facelifts for generations that are younger now than they were maybe 10, 15 years ago?
I think people are certainly more aware of it with all the social media, with Facebook posts and Instagram and all the, people are sending a lot of photos of themselves. Which means they're looking at a lot more photos of themselves. So in addition to seeing what they see in the mirror, you look at a photo and it's a really objective way of seeing the problems that you have in your face. So since our culture is going down that pathway of taking a lot more photos, sharing a lot more photos, people become, I think, a lot more self-aware of their aging features. And so they're coming to us and say, well, I hate the way I look on my Facebook post, or I hate the way this Instagram photos look. I think there's just a heightened awareness because we're photographing ourselves so much more.
Okay, so I have a question. Am I too young to have a facelift, or is now a good time?
It's never a question of too young. It's if you have features that are bothersome to you, we're going to give you the entire array of options of what's possible. So that doesn't mean automatically jumping to a facelift. We have an entire plethora of non-invasive techniques that we can use to try to avoid a more invasive surgery.
Okay.
And still turn back the time of the clock.
So you would suggest that instead of jumping into plastic surgery or a facelift, something that someone could do is step in and start preventative measures way beforehand.
I think that's a good way of thinking about it. I think that, to Mark's point, we don't have an algorithm or set of rules that says at 35 you need this, and at 45 you need this, and at 65 you need this. Our job is really to assess your face because people age at very different rates. Mm-hmm. We have people who develop a lot of skin laxity earlier in life and people who sort of hold on to some of their features a lot longer. So our priority is when a person comes in, number one is to get them to tell us what bothers them about their face. And then based on what their concerns are, we give them options. Some of those options might be surgical, but a lot of them are going to be non-surgical. And certainly starting off with non-surgical options is the easiest way somebody can sort of enter the plastic surgery world.
Okay, well, once someone makes the decision to have plastic surgery, how intense is the surgery itself and recovery time?
It really depends on the surgery that's performed. So if we're talking about minimally invasive procedures, these are things that can be done outpatient, same day, no downtime.
Oh, wow.
Then we go into the more moderate types of procedures, the mini facelift, the eyelid surgery, which are, I'd say, an intermediate recovery. Mm-hmm. And then a fuller facelift, brow lift, forehead lift is going to add a little bit longer time. And also there's the mix of procedures. If you add multiple procedures at one sitting, then the recovery is going to be a little bit longer. But these are not procedures that have downtime of months and months and take weeks and weeks to recuperate. They're still very short protracted times.
What would you consider a short time for a really invasive surgery?
Well, we tend not to do anything really invasive.
Okay, all right.
But in terms of what's the most you can do in one sitting for facial rejuvenation, we're talking about a full facelift, a neck lift, upper and lower eyelid surgery, a brow lift, and fillers of some sort using your own tissues, whether it be some of the tissue we'd normally throw away or fat that we harvest from liposuction and then put back into strategically placed areas in the face to give back volume. Because volume is another thing that we miss as we age.
Yes.
Because the fat atrophies as well as skin thinning out and dropping down.
Okay, would that be extremely painful to recover from? Is that like
not
a
at all.
1 week process, a 1 month process?
I think it's different for everybody. First of all, in terms of pain, no, our faceless patients don't tend to complain very much of pain. The first 24 hours aren't fun because you've been under anesthesia, so people often say, well, I didn't sleep very well that night. We have them sleep propped up with a bunch of pillows to keep their heads elevated to help with swelling, but pain isn't really a common concern. It's uncomfortable because your face is wrapped up and you often need some help, but it's not at all a painful surgery. In terms of the recovery time, I've had patients where you operate on a Monday and they go back to work that same week on a Friday, and then we have people for whom the recovery is more of a 2 to 3 week. The average person is more of a 2 to 3 week recovery.
2 to 3 week recovery.
And most of what we tell them is it's really social downtime. It's
Okay.
not that they're sitting around in pain, in bed, writhing around the floor, crying. It's that they're a little bit embarrassed to go out because they're a little bit black and blue, a little bit swollen. They'd rather stay indoors and take time to recover.
Well, thank you, Dr. Gaon. Thank you, Dr. West, for joining us. They are with us from Finesse Plastic Surgery, and you can check them out on their website.